Hi, I'm Sherry Torkos, and I'm here at the Palm Oil Nutrition Week in Malaysia 2013, and I have the great opportunity to interview Dr. Chandan Sen from the Wexner Medical Center at The Ohio State University. Dr. Sen, I have to tell you, I was totally inspired to attend your session yesterday to hear about the amazing benefits that the palm oil tocotrienols offer with respect to brain health and protecting people that may have a stroke. Can you comment a little bit further with respect to how the palm oil tocotrienols, these bioactives, can offer protective effects if somebody has a stroke?
So our research in the area really had to do with vitamin E and less with palm oil in the beginning, where in an unbiased manner we surveyed the 8 forms of naturally occurring vitamin E for their neuroprotective properties about 12 to 14 years ago. And we found that this alpha tocotrienol form of natural vitamin E was head and shoulder above all other forms of vitamin E in neuroprotection, to the point where it was showing efficacy at nanomolar concentrations, extremely potent. At that point, we started looking for natural sources of tocotrienol and figured out that palm oil has an abundance of it, so we tied up for a standard source of supply, and that's how we got in touch with palm tocotrienols. In the beginning, what we found were that neural cells were protected heavily against a number of insults relevant to stroke and brain trauma by tocotrienols. But more recently, we have now found that not only neuroprotection, but also after stroke, tocotrienols can stimulate arteriogenesis and rescue of insulted tissue following stroke. And more recently yet, that we have not yet published, which I reported yesterday, we now show that these tocotrienol-rich palm oil actually has anti-thrombotic effects, meaning it prevents blood clot formation, which also could feed into overall stroke efficacy.
That is just very exciting, and something that we don't see with a lot of the pharmaceutical drugs that we have today that offer one particular mechanism or another, but it looks like the beneficial properties of palm oil are really quite diverse. Now, can you comment on how you see maybe the future of using palm oil derived tocotrienols with respect to daily consumption for preventing stroke? Just as people today take aspirin, how would you say they compare with respect to their beneficial effects and also side effects?
I would like to first point out that at present, the clinical trial is ongoing. So what we just reported yesterday were some initial results. So until the trial has concluded and we have the final results, I'm not going to make any recommendations. But if you ask me to speculate looking forward, it seems that palm tocotrienols have a multi-targeted mechanistic approach that could be useful in stroke therapeutics and prevention, because as you know, in stroke it is not just therapy, but also secondary prevention. Once you have a mini stroke, you have an extremely high risk for another big stroke. And these are folks, plus folks that have a high risk factor for stroke that would be subject to secondary prevention. And under these conditions, I think palm tocotrienols may have promise by preventing clot formation, as well as neuroprotection, as well as rescue through arteriogenesis, as I just described.
And how would you say the safety profile compares when we're talking aspirin versus palm tocotrienols? Because I know that concern that I get from patients that are prescribed aspirin, it upsets their stomach, they're concerned about kidney damage, ringing in the ears. Can you comment on the safety profile of the palm tocotrienols?
You're right. Aspirin is known to have certain complications appear, including GI bleeding. In the case of tocotrienols, we have been now studying it on humans for about 7 years and have tested several hundred patients through IRB-approved studies, and we have not noted any adverse effects so far. We will wait until the currently ongoing clinical trial on victims of mini stroke is completed, but as of now, we have not seen. And as you also know, tocotrienol has already been awarded the GRAS status by the FDA, which is generally recognized as being safe. So compared to some of these other so-called drugs, this natural solution seemed to be softer on the health.
Yes, we're talking about a substance that has a lot of beneficial effects with really no side effects that have been discovered to this point in clinical trials. I guess one last question or comment that I would have, I was really surprised to learn that the benefit of the palm tocotrienols are sustained in the body even after a patient stops taking the supplement, compared to when we take pharmaceuticals like aspirin. If a patient doesn't take it every day or every other day, they lose the benefit. Can you just comment a little bit about that and what you discussed yesterday in your seminar?
Yeah, that's a very interesting observation. You're right. If somebody taking aspirin does not take aspirins for, say, 48 hours, the effect on anti-clotting properties, if you will, start losing. And that is because about a tenth of all the platelet of the body is made new every day. So if you don't have an aspirin memory in this new fraction of platelet that just got made, that anti-clotting property would not be retained. In the case of tocotrienol, what we are seeing is that if you took it for, in our case, in our study, as I showed yesterday, for a couple of months, it would load into subcutaneous fat tissue, and then that fat tissue gradually releases the tocotrienol into the bloodstream. So you have some sort of a time release system, a body's own time release system, in which case now we have observed, as I showed yesterday, that up to 10 days of stopping tocotrienol intake, you still have a complete abrogation of arachidonic acid-induced platelet aggregation.
And that could be really meaningful for patients that maybe have compliance issues. They don't remember to take their product every single day. Just to know that they have a little bit of a buffer. If they forget to take it for a day or two, the benefits are not lost.
I would like to hope so. We will wait until the end of the trial to see exactly what happens.
Well, thank you so much for your time. It's a pleasure to be here with you today. And thanks again, Dr. Sen.
Thank you so much. Thank you so much.